afternoon, live from Toronto on the GBKM network. This is the Chat Up Show, the show where we catch you up with the chat up of our weekly headlines. I'm your host, Elizabeth Aloyde, and I hope that you are ready to chat it up with me today. Now, as always, you know you can keep up with the GBKM network in various ways. You can listen and watch live 24/7 at www.gbkm.tv or www.gbkm.fm, where, as I said, you can listen and watch live. You can also catch up on our past shows that you may have missed throughout the week. You can check out our upcoming show schedule so you know which shows not to miss throughout the week. You can, of course, learn more about our on-air personalities, check out our breaking news tab, and like, share, comment, all of that good stuff. You can also download our free app, which takes everything with you on the go. You will be notified every time we go live. You will get the exact same features, listening and watching 24/7, any past shows, upcoming shows, all of that stuff on our free app. It is 100% free, available for all iOS and Android devices. So just check out the GBKM app and download it today so you will be notified when we go live. You can watch us on the go and all of that good stuff. You can also continue to watch us on Facebook and YouTube at GBKM Network, where as well you can continue to like, share, comment, and subscribe, joining in the conversation. You can also follow us on Instagram and Twitter at GBKM Network, where you'll receive updates of what's going on right here at the GBKM Network. Now, there have been a few updates regarding our situation with the pandemic in Ontario and with the Delta variant causing worries for what's to come with the fourth wave of COVID-19. We are seeing more policies being put in place in efforts to protect the most vulnerable people and communities and high-risk members of our communities, from hospital organizations to police services and sports venues requiring proof of vaccine status or negative tests to be able to, enter the premises, to the province beginning to offer third doses of the COVID-19 vaccine to those at highest risk, providing them with an extra layer of protection against that Delta variant. So these are some new policies that we're seeing come into place in the recent weeks and in the weeks to come. It also seems like we're getting closer to a time where the COVID-19 vaccines will become somewhat mandatory vaccines that we see when, you're starting school and you have to be up on your vaccinations for your kids from, measles, flu shots, the mumps, polio, all of those things. It looks like the COVID-19 vaccines will possibly be added to this list. Now, we did talk about this not that long ago, right here on the Chat Up Show. We talked about, will there be a potential or possibility of vaccinations becoming more mandatory, there being more mandates put in place to protect those who let's watch what we say here. Essentially to protect those who may be unvaccinated, but also to protect those who have been vaccinated in a sense as well. We kind of saw this coming. It's not a shock to a lot of people. We kind of felt that this was what was going to happen, that to ensure that we're protecting our highest risk and most vulnerable members of our communities, that there will be certain procedures being put in place now that things are opening up a lot more. We're starting to see capacities potentially being lifted in certain areas based on vaccination status and the number of people that are vaccinated within our province. Now, I'll get into a little bit more of that later on in the show, but of course, with these new policies being put in place, there has been some pushback from people who feel that this is just another way that the government is trying to control the narrative, control the quote-unquote herd, trying to control our choices in our lives. And even though the vaccine was presented as this free option, it is seeming as though it's no longer an option for those who felt that it was before. Now that schools are also reopening, there is the worry for students and teachers' safety, especially. Of course, not everyone is happy about the possibility of needing to be vaccinated to keep your job, which is what we are potentially seeing with some of these new policies coming into place. So with universities and universities like the University Health Network as well, that is a possibility that those who are unvaccinated after a certain period of time may be at risk of losing or being terminated. Now, we'll get into that, as I said, a little bit later on in the show. We're just going to dive into what will be potentially mandatory within our province of Ontario, and maybe taking a little bit of a glimpse of what's going on as well in our home of Nigeria, specifically Edo State too. So we actually have a clip right now. For those who are thinking that the only source of control is happening here in North America, because we have here similar reports in the U.S. where people are not being allowed in certain establishments who aren't vaccinated, and Canada and especially our province here in Ontario following suit. But we have official record right now from footage of a press conference earlier this week of Edo State's governor, Godwin Obaseki, essentially saying that those who are unvaccinated will not be allowed to enter and be in certain spaces, in certain public spaces, even in certain private spaces. So let's check out this clip that was captured by AIT of what this press conference was. Take a look.
Showing proof of their vaccination cards at the gates of these occasions. We have made adequate arrangements with security to prevent anybody who does not have a vaccination card from accessing any of these events. Also, you will not be allowed to access banking services in Edo State from the middle of September if you have not been vaccinated. If you want to undertake banking services, you will do so remotely from me. People who are not yet vaccinated at all will have to depend on remote access to these gatherings. So from the second week of September, people may not be allowed to worship in churches and mosques without showing proof of their vaccination cards at the gates. Similarly, people will not be allowed to event centers for parties or receptions without showing proof of their vaccination cards at the gates of these occasions. We have made adequate arrangements with security to prevent anybody who does not have a vaccination card from accessing any of these events. Also, you will not be allowed to access banking services in Edo State from the middle of September if you have not been vaccinated. If you're showing proof of their vaccination cards at the gates.
Now, this was from a press conference reported by AIT of Governor of Edo State, Godwin Obaseki, essentially going over the new policies regarding vaccination status and public gatherings. Now, as you heard there, those who do not have proof of vaccination will not be allowed into banking facilities for banking services, into churches and mosques as of mid-September. Now, these may seem a little extreme. Here in Ontario, we haven't reached that level yet, where the government is essentially mandating that people cannot gather in such public spaces. Even in this press conference, we heard Governor Obaseki say that even some parties as well, if you're hosting any parties or receptions and people do not have their proof of vaccinations, they will not be allowed to attend. So essentially, if you are unvaccinated in Edo State as of September, chances are you will probably be under some form of lockdown, because a lot of the public spaces will require proof of vaccinations to enter. Now, in terms of here in Ontario, to protect our vulnerable patients and staff in settings where the risk of contracting and transmitting COVID-19 and the Delta variants are higher, are where a lot of the focus is being placed in terms of these new policies regarding who needs to be vaccinated to enter certain facilities. So Chief Medical Officer of Health has issued a directive mandating hospitals and home and community care service providers to have a COVID-19 vaccination policy for employees, staff, contractors, students, and volunteers, for ambulance services to also have a COVID-19 vaccination policy for paramedics. So if you're working in the health sector, chances are there's going to be a policy being put in place in coming weeks, if not already, regarding the vaccination mandate and policy put in place. Now, the vaccination policy, according to our Chief Medical Officer of Health, it cannot go into effect later than September 7th, so in the next couple of weeks, and at a minimum will require these individuals to provide proof of one of three things. So if you find that your workplace, if you work in these sectors, is putting in place a certain vaccination policies, these are three things that you will need to provide proof of, at least one of the three things: a full vaccination against COVID-19, a medical reason for not being vaccinated against COVID-19, or completion of a COVID-19 vaccination educational session. So individuals who do not provide proof of full vaccination against COVID-19 will be required to undertake regular antigen testing just to prove that you have not contracted COVID. So if you do not want to be vaccinated and you still essentially want to keep working at this place of employment, then the other alternative is to have a proper medical reason as to why you are not vaccinated, and also followed by regular testing for the virus. Now, a lot of people feel that this is an infringement of privacy and that there's no reason you should be sharing your medical records or history. And there are some lawyers who are advising that if you do not want to prove that you have to prove that you can be in a certain space, you can tell your employer that as long as there's proper safety precautions put in place, as long as there's mask wearing, as long as there's proper social distancing, as long as there's proper procedures being put in place to ensure that everyone is staying safe outside of the vaccination, that there's no reason why they should be imposing or infringing on your rights, your human rights. That is the argument that is on one hand. And on the other hand, there are other folks who are saying that this is the best way possible to ensure that everyone is staying as safe as possible. And it's more put in place for those who are not vaccinated, because those with the vaccine, we know, even though you can contract the virus. I say that again, even though while you are vaccinated, you can still get COVID-19, the likelihood of you ending up in a hospital bed are far lower than if you are unvaccinated. And we're hearing with this Delta variant that has essentially mutated and grown stronger and is a little more aggressive towards your immune system. People feel safer being vaccinated. People feel safer being around those who are also vaccinated, because they know that, I'm safe, you're safe, we're all safe, we're all happy. And that's essentially what we've been going for throughout this whole pandemic, with all of the measures being put in place. The mask mandates and that bylaw that was put in place where you have to wear masks in indoor spaces and outdoors at some point as well. Social distancing, practicing proper social distancing, ensure there are spaces for hand sanitizing stations set up in certain areas, make sure that there's adequate hand washing in place for certain areas as well, if it's hard to keep your social distance and you want to do that extra mile. These things have been put in place to ensure that we're all keeping each other safe, and this is another step. Now, I'm not going to sit here and argue whether it is the right step, whether it is or isn't infringing on human rights. We're here to just, disseminate this information and share it with you so that you're aware of what your choices are, but also aware of what is going on in terms of our government's policies and mandates being put in place, so that you kind of know where you stand to see how you want to make your next move. Now, I'm sure a lot of people do have an opinion on whether this is infringing on human rights, and you can for sure let us know in the comments below how you feel about these certain policies being put in place. Now, mind you, this particular policy that I just went over from our chief medical officer regarding people who are working in community care services or hospitals, from students to volunteers to paramedics to all employees and staff, needing to show proof just so that they're safe and they're keeping patients safe. This isn't across the board yet. We're just seeing these in certain spaces, in certain sectors, in certain businesses, just because it's hard in certain situations. For example, in a hospital, you're not always going to be able to social distance, right? Things aren't always going to go to plan. You're going to have to engage and interact with people. And if you're constantly in everyone's space and you're not able to, you want to make sure that you're protected on another level, which is why they're bringing up the idea of a third dose for those who are higher risk within those spaces and those areas, just to protect themselves or protect them against this Delta variant that is popping up a lot more these days. Now, in these settings, they will be required to track and report on the implementation of their policies to the provincial government. So everything is going to be tracked and will be going back to the provincial government. Take from that what you will about that whole policy and what that would mean, that if you refuse to go be vaccinated in certain cases, then that will probably be tracked and reported as well and go back to the provincial government too. Now, this is similar to the vaccination policy requirements currently in place for long-term care homes. It hasn't really changed. It's just now more across the board. Now, our Deputy Premier and Minister of Health, Christine Elliott, said, while Ontario remains a leading jurisdiction for first and second doses administered, and we have the infrastructure in place to manage outbreaks, the Delta variant is highly transmissible, and the experience of other jurisdictions show we must remain vigilant as we head into the fall. So this is why we're seeing more of these policies and mandates pop up, is because, as we go into the fall seasons, like we saw last year, cases are rising, and we're seeing them now again. Cases are rising as we're going into the colder seasons, and our public health sectors are trying to minimize the outbreaks and, kind of get ahead of the situation, since we've seen the pattern from last year. Now they're trying to put policies in place to ensure that it's not as bad as before. So hopefully we're not going to go on another 8-9 month lockdown like we were last year. She also went on to say that by taking additional measures in high-risk settings, we will further protect our most vulnerable, safeguard hospital capacity, and ensure a safe return to school and keep Ontario running. Now, to support the return to school plan, the Ministry of Education intends to introduce a vaccination disclosure policy for all publicly funded school board employees and staff in private school, as well as for staff all licensed in childcare settings for the 2021-22 school year. And of course, there will be rapid testing requirements for staff who are not immunized against COVID-19. So again, there will be a policy also being put in place for schools as well, for staff. And for those who are unvaccinated, then you would probably have to undergo rapid COVID testing on a regular basis. Now, the Ontario government is also working with public health units and publicly funded school boards to run voluntary vaccination clinics in or nearby schools to make vaccines even more convenient and accessible for eligible students, their families, educators, and school staff returning to the school for this fall. Just because we know that the eligibility for vaccines has now gone to people who were born 2009 and up. So younger kids are now being able to get their vaccines as well. So the government is trying to make it easier for those who want to get the vaccine to get it in time for the school year starting up again in fall. As we remember, it is back to school season, and kids are going to be going back to in-person lessons, as now we are in our third step of reopening, which we'll get into a little bit later. But just to finish up, the vaccination policies in the province right now. So the vaccination policy that will also be implemented in other high-risk settings, such as post-secondary institutions, licensed retirement homes, women's shelters, and congregate group homes and day programs for adults with developmental disabilities, children's treatment centers, and other services with children with special needs in licensed children's residential settings. So this will also be a policy that those institutions will follow. So for those of you who are going back to college, this is something that you need to think about as well. This is for you. This is for y'all. Okay. So our Minister of Education, Stephen Lecce, also said that with the support of Ontario's Chief Medical Officer of Health, our government is taking action to make schools as safe as possible. Our plan will protect our schools, ensure rapid speed with contact tracing, all with the intention of keeping them open for the benefit of Ontario students. The Government of Canada also announced that it will be making vaccinations mandatory for all federal employees as early as the end of September. Okay, so that's on a federal level. This is not just provincial, like this is across Canada. In addition, the government confirmed that employees in the federally regulated air, rail, and marine transportation sectors, as well as commercial air travelers, passengers on interprovincial trains, and passengers on large marine vessels with overnight accommodations like cruise ships, will also be required to be vaccinated by no later the end of October. So if you're planning on traveling for work or for anything, you will need to be vaccinated. Now, this is just a reminder of what our reopening plan is. And we know that we are in the 70 to 80% of fully vaccinated, of first dose vaccinated. Actually, we're past that. Now we're almost to 75, I think, fully vaccinated at this point. But we're still staying in the third stage. Now, the reason for this is that the Ford government had intended to lift virtually all remaining public health restrictions once 75% of residents were fully immunized. But they put a hold on that due to concerns about the Delta variant driving the fourth wave of the pandemic. So we're going to be stuck in stage 3 for a little bit longer. Of course, basically everything is open. It's just that there's limited capacity. Now, an additional measure to continue protecting Ontario's most vulnerable, as I mentioned before, was that there is the potential of a third dose of the vaccine to those at highest risk. This is hoping that if we keep our most vulnerable protected and vaccinated, then that would mean we'd move on into reopening a little bit more. I'm going to get into what the possible plan for that will be, but just to go over what this third dose will look like and who is in the highest risk group. This includes people who are transplant recipients, including solid organ transplant and hematopoietic stem cell transplants. So if you're a transplant recipient, patients with cancers like lymphoma, myeloma, leukemia, on active treatment like chemotherapy or other targeted treatments, recipients of an anti-CD20 agent, residents of high-risk congregate settings, including long-term care homes, higher-risk licensed retirement homes, and First Nations elder care lodges. These are the people who are part of the high-risk population in our communities, outside of course, those who live in the long-term care homes, as we mentioned as well. So if you know of anyone in this situation or who fits into this category, there's a potential that they will be receiving, or the government has said that yes, that they can go ahead and receiving a third dose to protect themselves. Now, there are a lot of questions that come to mind about this. Will this then, translate to everybody else requiring a third dose of the vaccine to be fully protected against the Delta variant? Are we going to just stop at 2 doses for the rest of the not so high risk or vulnerable populations? People who are on these lists, and are they going to have to get a 4th dose after that? Would it be considered fully vaccinated completely if it's like 1.5 essentially, because we know it's 2 doses for a full? So then would they need another dose after the 4th? This is still being worked out with the government. We're still yet to hear just when these policies go into effect and what that looks like. Now, look, the locations and timings for the third doses will actually vary on the public health unit and the high-risk population based on local planning and consideration. So some could begin as early as this week where opportunities exist, and we'll probably be seeing that all through, September and probably into October. Now, in addition to further support a safer return to school by ensuring more children and youth can benefit from the protection offered by the vaccine, we now know, as well as I mentioned this earlier, that children born in 2009 and up are eligible for the vaccine. So you can go and get that. And with more people eligible for the vaccination, meaning more of our population will receive protection. Chief Medical Officer of Health, Dr. Kieran Moore, said that he supports the lifting of the capacity limits for many venues that mandate vaccination, though he acknowledged that it is a decision that ultimately has to be made by the Ford government. So he's saying that if as we're getting more people who are fully vaccinated, then we could potentially lift the limit or the limit cap for certain venues that are also requiring proof of vaccination upon entry. He said, quote, "I would think that the government should assess that if everyone in that environment is immunized, then that's a very low risk event. So I would hope that the government will make a decision to enable them to move forward, even if we have other restrictions in place." Moore said that he would like to see Ontario reach a point where 90% of eligible residents are fully vaccinated, though he acknowledged that the target is an aspirational goal and should not be a measure by which we can hold businesses back. He said that he is very supportive of businesses that have adopted vaccination policies, specifically citing that the Ontario Hockey League, which announced this week that it would require proof of full vaccination for those wishing to access any of its facilities. He also alluded to other policies being put in place by professional sporting organizations like Maple Leaf Sports and Entertainment, which owns Toronto Raptors, Toronto Maple Leafs, and Toronto Argos, has said that it will require that employees and guests provide proof of vaccination or negative COVID-19 test results to access their facilities as of mid-September. So Dr. Moore is essentially backing these businesses who are saying that you need to show proof of vaccination or proof of a negative test to be able to access these facilities. Of course, not everybody is happy about that because folks just want to be able to get back to their regular activities, their regular scheduled, social settings and activities, and being able to be back in sports arenas again after so long that, we haven't been allowed to be back in. Folks are excited to get in, but this is a way to kind of like ease our return back into these large group settings, essentially is what it is, hanging out in crowds. We saw Lollapalooza a couple of weeks ago in Chicago. We saw the amount of crowds, and then hearing how cases were skyrocketing just a few weeks after that. putting two and two together, you notice that just because certain people are vaccinated, but there are others who aren't, and then everyone coming together in large crowds that don't really allow for much social distancing, everyone's excited to be outside. We kind of forget about some of those precautions we were following before. Maybe the mask comes off a little bit. Maybe you start singing with the person next to you, and things happen. Next thing you know, there are people who are passing out and fainting at the very festival. There are people who have to be carried and whisked away by security and paramedics because, they were sick and they didn't know it until they got to Lollapalooza. There were certain people who were performing and they were sick, and then because it's their job, they went through with it, and then they found out that they're positive and it's a whole thing, but because they don't want to get vaccinated, they're worried about what's going to happen to them. And then there's also the fear of long COVID. The side effects of COVID after you've quote unquote recovered, what happens to your body after that? People who are still dealing with respiratory issues where they have so much scarring on their lungs and they're not able to fully recover, that their bodies are still not at 100% after dealing with the virus. These are a lot of things that are happening and we're seeing it happen, but then at the same time, it's a worry for some because they feel that this is another way for the government to control you by putting these mandates in place, saying that you can't enter certain facilities, you can't use certain facilities unless you are vaccinated. Seeing it in Edo State happening now with this new policy put in place, that if you want to do your banking and you're not vaccinated, sorry, you have to do online banking. Accessibility is one thing that pops to mind with that. If you want to, go to church and worship or go to a mosque and pray, you can't do that unless you have proof of vaccination. For a lot of folks, they feel that even people who are already vaccinated, they feel that this is maybe a little step too far. But are we all that much surprised about what we're seeing being put in place? That there are certain facilities now that are requiring proof of vaccination or proof of a negative COVID test. We're even seeing some employers, put in new policies regarding what they have to do with their employees. And we're actually going to get into that right after a quick break. So make sure you stay tuned on The Chat Up Show.
Do you want to be your own boss and make income or extra income with flexible schedule? Welcome to Keenan Courier. Keenan Courier works as a marketplace platform connecting customers who need something delivered with drivers that are willing to serve them. Courier with any vehicle, better trip allocation, and cash out your earnings whenever you want. Download our driver apps today to sign up. Do you want to be your own boss and make income or extra income with flexible schedule? Welcome to Keenan Courier. Keenan Courier works as a marketplace platform connecting customers who need something delivered with drivers that are willing to serve them. Courier with any vehicle, better trip allocation, and cash out your earnings whenever you want. Download our driver apps today to sign up.
Hello and welcome back to The Chat Up Show. I'm your host, Elizabeth Oloidi, and today we are discussing whether or not it will be required or mandated to show proof of vaccination in Ontario in the next month. Now, before we went on a break, we were discussing the new policies that were being put in place or, being suggested to put in place by certain sectors and businesses. For one, long-term care homes, those in the health sector, where mandates are being put in place that if those who are vaccinated should be vaccinated, and those who aren't will need to be tested regularly for COVID-19 to ensure that they aren't transmitting it. Those who are also in a part of the higher risk members of our community will possibly be getting a third dose of the vaccines just to protect further against the Delta variant. Now, we talked about the province. Now let's kind of micro size it into Toronto. Now, there's some new policies put in place in Toronto that haven't been necessarily put in place within the province, that the provincial government hasn't come out and say that, yes, this is a full-on policy that the whole province has to back. Now, as of on August 19th, last week, the City of Toronto announced that all of its employees will be required to disclose their vaccination status and provide proof of vaccination, if applicable, by no later than September 13th. So that is for all City of Toronto employees. Now, any employees who have not been vaccinated or who do not disclose their vaccination status by September 13th will be required to attend a mandatory education on the benefits of vaccination. Now, this was a part of the policy that was presented for the province, saying that this is one of the three things that you'll need if you're not vaccinated and can't prove that you are vaccinated. Either you have to bring a negative test, or you have to bring a proof that you have received vaccine education to let you know that you understand the science behind the vaccines, and yet you're still opting out of it. Those individuals will also then have until September 30th to provide proof that they have received the first dose of the vaccine, and by October 30th, all employees will be required to be fully vaccinated. So we're looking at, by October 30th, all City of Toronto employees, according to this new policy that's been put in place, will be required to be fully vaccinated. So it's a series of steps that they're going through to reach this end goal of everybody being vaccinated, or essentially goodbye. Is that first you have until September 13th to provide the proof that you are vaccinated. If you cannot provide the proof, you then have to go for the mandatory vaccine education. And then after you've received the mandatory vaccine education, you have until September 30th to then get your first dose. If you then, after going through all that, say, yes, I want to be vaccinated, and then by a month later to receive your second dose. Now, as with the government in Canada, the city confirmed that it would comply with human rights obligations with respect to accommodating employees who are unable to be vaccinated. So that's just to cover that. A lot of people are thinking, does this violate human rights in any way, shape, or form? Here is the government of Canada, and especially the City of Toronto, saying that they will comply with human rights obligations if you can provide necessary proof that you can't get vaccinated for some sort of reason, and they'll try to accommodate that. The city also noted that as the largest employer in Toronto, it was taking a leadership role in making COVID-19 vaccination mandatory for its workforce, and that agencies and corporations of the city would be encouraged to do the same. So this is coming from our powers that be, if you want to put it, in the city. Now, as of August 20th, Toronto's Medical Officer of Health and Toronto's Public Health issued a statement strongly recommending local employers to institute a workplace vaccination policy in line with that was implemented by the city. So basically, provide proof that you're vaccinated by mid-September, by end of September, get your first dose, and then by end of October, receive your second dose. If you cannot provide that proof by September 13th, you will go to mandatory vaccine education, and then hopefully go on to receive the necessary doses of the vaccine. So this is what the city is hoping that everybody else adopts as a policy in terms of vaccination in workspaces. Now, the city is also strongly recommending that organizations determine a method for attendees of gatherings of 1,000 individuals or more to demonstrate proof of their vaccination status and to follow public health measures. We know this about the Maple Leafs Entertainment, that they're doing that in their sports venues, as well as the hockey league as well. That they're doing in their venues, that they will require proof of vaccination. We even know in certain adult entertainment venues in the city are also requiring proof of vaccination status or proof of a negative COVID testing, and requiring their employees to also be vaccinated. So it's not like there are no businesses that are already doing this. It's not like there are no venues or establishments that are already putting this in place. It's just the city is encouraging everybody else to also put these policies in place as well. For example, we have the Toronto Film Festival starting up in the next couple of weeks, and the festival is requiring Hollywood talent and execs attending to show proof that they have been fully vaccinated. I mean, of course, this makes sense because people will probably be flying in, which is a worry for many people because the Delta variant is very real out here, and having international folks flying in for a film festival just doesn't seem fair. But they are requiring proof of vaccine, and also the how are we keeping safe protocol that we see on the screen right now is the same one that we will continue to see being followed, even with these policies put in place. So even at TIFF venues as well. It's unsure if whether at TIFF venues this will then spill over to those who are going to go watch movies, patrons. They are yet to announce that yet, but it's looking that that's probably likely. Otherwise, they're going to continue with the virtual. So it's half the hybrid style of in-person, half virtual, half, doing that. So how we're keeping safe is we're in entrance screening. One of the methods was, to make sure that people are checked for symptoms upon entry and temperature checks. Of course, the masking is still up for debate for some reason. People still don't know why we still need to be masked if folks are vaccinated, because not everybody is vaccinated. It's just an extra step of precaution and extra measure that we can take to make sure that everybody's keeping safe. Physical distancing. Physical distancing as much as possible, even if you're vaccinated, unvaccinated, doesn't matter. These are just extra steps that you can be taking to keep yourself safe, especially if you're unvaccinated. Also, infection prevention methods like wearing proper PPE, face shield, gloves if you need to, and then washing and disinfecting as much as possible. So we're still keeping with these. These aren't going away. We're just adding another layer to it where you may also have to add that you are fully vaccinated, and then maybe we might ease up on some of these precautions. We know that we're still not there yet. We're still on our step 3 of reopening, as we see here, because, as I mentioned before, that Dr. Moore says that when we start seeing a 90% fully vaccinated rate, then maybe we can start lifting certain capacities in certain areas, in indoor venues, because then majority of the population will be fully vaccinated at that point. But for now, this is where we're stuck. We're stuck with the limits on certain gatherings and ensuring that even with these festivals and events going on, that there's still measures being put in place to ensure that people are still staying safe. Now, the Toronto Police Service also said on Tuesday that it will require all its members to be fully vaccinated against COVID-19. Now, this was something that the union representing officers opposed, that they do not agree with this policy. So the force said its vaccine policy would apply to both uniformed and civilian members, and all staff would need to provide proof of their immunization status by September 13th, following along with the city's plan as well. Interim Police Chief James Rammer said in a statement that the safety of our members, quotes, "The safety of our members, our workplaces, and the public is of utmost importance to us. Our members will be required to be fully vaccinated to protect each other and the communities we serve." Now, the service also noted that the vaccine policy would adhere to accommodations required under the Human Rights Code that I mentioned before. If there are religious reasons or other documented medical reasons as to why you cannot receive a vaccine and why you are going unvaccinated, then they would adhere to that, because that's within your human rights. They can't violate your human rights and tell you that you have to get vaccinated if you can prove that you shouldn't. Now, it all lays in proof. And let's just remember, if you can prove that you don't need a vaccine, sure. But if you cannot, it's a little more difficult. And I will get into that, but let's just remember that for a little bit before I get into a little bit more of that. But just to continue on with what the Toronto Police Service says, that the specifics of our policy and its implementation are currently in development. Toronto Police Association, which represents about 8,000 uniformed and civilian members of the force, have said that they were opposed to this announcement of requiring proof of vaccine by September 13th and requiring all employees essentially to be fully vaccinated by the time set by the city. The association said the policy was announced with no documentation, procedures, or orders in place to support it, and added that it would be working with the affected parties to explore collective options. So police service is saying one thing, union and association is saying no. You did not do this the proper way, and we are essentially going to fight it. Now, when you're thinking of the police services and unions, protect and serve, all of that thing, they are a symbol still in our society, even though there are a lot of people after recent events who feel a different way about the police. They are still representing, serving and keeping our community safe. And then you hear certain people who don't want to do what their service is saying, who don't want to go with what our government is saying, who are saying that no, you can't go against human rights, you can't put these mandates and policies on us and force us to essentially do something that is against our will. The vaccines were introduced with the idea that this is your choice, you can choose to take it or not, whatever you want to do. And now there's a potential that certain people's jobs may be at stake, because the University Health Network is saying that if you are not vaccinated by a certain date and you refuse to be vaccinated up until that date, then they could terminate you and you would be losing your source of employment. So with the Toronto Police Association, they're saying, no, back up. There needs to be proper documentation. There needs to be proper implementation of this policy before you're just going to spring it on people because the city said so. Now, the police force said it would maintain public health measures such as the use of masks and social distancing that we had on the screen earlier, among other precautions, to ensure that safety is still being upheld. So, universal mask wearing, screening, disinfecting everything, wearing proper personal protective equipment, from gloves, face shields, masks, all of that. They say the police force says that they will continue to adhere to those precautions, but to then add this new policy of requiring proof of vaccination is a step too far. Now, Toronto Transit Commission also said that contractors and students would need to be vaccinated by September 13th. So that is like even earlier than a lot of the other sectors have said, that by September 13th, the Toronto Transit Commission requires employees, contractors, and students to be vaccinated by September 13th. Metrolinx, which is the Ontario transit agency serving much of the greater Toronto and Hamilton area, said it also plans to require staff to get vaccinated, although final details of the policy, including consequences for unvaccinated workers, were still in the works. Now, this is what we're seeing happen pretty much across the board, that we're still seeing these policies being put together, that they're not completely finalized, and figuring out what the consequences are if you do not meet the requirements of October 30th being fully vaccinated. What could those consequences potentially be? Could you get fired? Well, as I mentioned before, the University Health Network says yes. But before we get into that, the federal and various provincial governments have recently announced mandatory regulations, as I mentioned, for specific jobs or sectors. We talked about this with certain health sectors. And beyond that, forcing employees to be vaccinated could lead to a human rights violation, as I mentioned before, not to mention a breach of privacy, which is what a lot of people are concerned about, disclosing their personal medical history. An employee who is let go for this reason, who is let go for the reason of, not providing proof of vaccination, or not providing proof of, why you don't want to get vaccinated because of the religious or medical reasons, you may be terminated. But according to various employment lawyers in the city, that you are likely owed full severance pay, and if they do not pay you, then you have grounds to sue for the pay. The University Health Network, now let's get into this. So the University Health Network has confirmed that any employee who decides not to get vaccinated by the end of October will be terminated. So that's essentially giving you a good 2 months to kind of prepare yourself, right? They're saying that if you're not vaccinated by October 30th, then you will be terminated. UHN, whose hospitals include Toronto General, Toronto Western, and Princess Margaret, confirmed the new policy in a statement last Friday. And the statement said that the hospital network said it has connected with more than 900 staff who have either not provided their vaccination status or have indicated they are not vaccinated. After October 8th, anyone who is still not vaccinated will be placed on unpaid leave for 2 weeks. Okay, so this is if you're working in any of the hospitals that's connected to the UHN. If after October 8th, anyone who is still not vaccinated will be placed on unpaid leave for 2 weeks. And if it's still their decision at the end of the 2 weeks that they do not want to be vaccinated after that date, then their employment will end. So if by October 8th you say you do not want to be vaccinated, if by October 8th you say you're not vaccinated, 2 weeks after that, come back and see if you want to be vaccinated, and if not, your employment will end, according to officials. Now, prior to this new policy and directive, staff at UHN who were not vaccinated or who did not provide their vaccination status had to submit regular COVID testing prior to arriving at work. Now that's not even an option anymore. Your job is just terminated. Kevin Smith, who is the Health Network CEO, told reporters in Toronto earlier this week, the policy led to an uptick in vaccinations, actually. I mean, if people are fearing that they're going to get fired and they're going to lose their source of income and they're going to lose their employment, chances are they're probably going to follow in line and get the vaccine just to keep their job, He said that the percentage of employees vaccinated rose from 85% in late July to the current rate of 92% right now in August. So basically he's saying that, this policy worked, and what we wanted to get out of it, that more people were going to be vaccinated because of the fear of losing your job. In Ontario, Now let's look at the legal ramifications of this. In Ontario, employers have the right to terminate non-unionized employees, employment without cause, though this right is not risk-free, of course. Like, there are chances that people will come back and sue the employer for, not firing them for any real reason. But if you're not unionized and your employer says that by a certain date you have to be vaccinated and you lose your job, it's essentially legal for them to do that. For example, if such termination is discriminatory under the Ontario Human Rights Code, as we mentioned before, the terminated employees may have a human rights claim or wrongful dismissal claim against the employee, against the employer. But if not, chances are you don't have as much of a case to stand on if you want to then take it to court and if you want to sue your employer, because they are working within the bounds of the law within Ontario. Some employees may not be able to get the COVID vaccine, as we mentioned, due to religious reasons or medical conditions. As long as you can prove that, as I mentioned before, you will be fine. So, for example, employees have a right to be free from discrimination because of religion, disability, and other enumerated grounds. It is important to note that not every medical condition is a type of disability within the meaning of the code. This is the Ontario Human Rights Code. Further, political beliefs are not a protected ground of discrimination under the code. So if you're saying that you don't agree with the current government that is putting this into place, and because they are not of the same political beliefs, you don't have any grounds to, go against that. You can't use that essentially as proof as to why you're not being vaccinated because you don't trust the current government. So this is just giving you an idea of, what could potentially happen now that these new policies are put in place. For now, we're looking at October 30th as the deadline for majority of these employers putting these policies into place and mandating vaccination proof. So essentially to answer the question, will it become more common to see proof required in certain places in Ontario regarding your vaccination status? Probably. Will it be required across the world? I mean, yes. We're seeing with international travel already. I mean, we're starting to see it in Edo State with, common errands that a lot of people are running, that if you want to go to the bank, now you're going to have to carry your proof of immunization with you as well. We might start seeing that become more of the norm and become more widespread even here in Ontario, in Canada, in Toronto especially. Just going back to the press conference earlier this week from Edo State, of the Edo State Governor Godwin Obaseki, who was going over the new policy regarding proof of vaccination in Edo State now, that you will be required to show proof, vaccines of going to churches. Who knows if that's what's going to start being part of our policies and mandates here in Ontario as well. Going to the bank, going to all these different venues. I mean, a lot of people were worried that it would become to the point where even just to go to the grocery store, you would need to bring a proof of vaccination. If we're starting with jobs and starting with terminating people from their employment if they don't adhere to these new policies, which, by the way, haven't 100% been fully put in place by the provincial government. Right now, it is suggestions from the powers that be, yes, that certain employers should put these policies in place in their private sectors, public sectors. It doesn't really matter, as long as it's keeping people safe. At the end of the day, their idea of it all is that we're keeping our high-risk population safe, we're keeping our whole population and community safe. If that's what it takes, if it means that you're going to need to provide certain proofs to enter certain places for a while, then maybe that's what it means. Now, just going back to the employees and employer potential termination of your employment based on this vaccination status, employees requesting an exemption from vaccination policies may need to give specifics of the disability that they say impacts their ability to get vaccinated. Of course, without breaching their privacy, but to engage the employer's duty to accommodate. So if you are asking for accommodation because you don't want to be vaccinated, you will probably have to be prepared to get some questions from your employer, and for them to really understand how they can best accommodate you as per your medical conditions. So just summing things up is that right now in the next couple of months, we're probably going to see a lot more policies being put in place, which will then, of course, influence the rate of vaccinations. Already, as we know, Ontario is leading in the rate of fully vaccinated adults province-wide. But if it's going to get to the point where there are going to be a lot more policies put in place to get it to 100%, you know, Dr. Moore was saying we want to get to 90% before we start limiting capacities. We could probably assume that the province wants to reach 100% of fully vaccinated adults. Otherwise, if it's 90% of fully vaccinated adults, ensuring that that 10% of unvaccinated adults are kept at bay or kept safe, in other words. It's definitely going to be interesting. We'll definitely keep you updated regarding these new policies right here on the GBKM network. And that concludes our show for today. Again, remember, it's important we continue to wear our masks, social distance, all of that stuff. Remember, we're still in the middle of a pandemic. We're still trying to stay safe. We are essentially in our fourth wave right now. We're starting to see those numbers climb. So we're probably going to start seeing a lot more from our governments regarding these new policies to try and curb that rise as much as possible. So to ensure you're staying updated on it, make sure you're keeping up with us at the GBKM network by listening and watching live 24/7 at www.gbkm.tv or www.gbkm.fm. You can also download our free app available for all iOS and Android devices, the GBKM app right now, where you get the same features on our website as on the app. And you'll never miss a show again because you'll be notified every time we go live. Continue to follow us on Facebook and YouTube at GBKM Network, and Twitter and Instagram at GBKM Network. And you can follow me, your host, on Instagram and Twitter at TIS_Liz_O. And I will see you same time, same place next week. Take care.
The bad news is that everyone is a potential victim. But the good news is that everyone is a potential solution. Sensitize the masses to sanitize. Keep a social distance and quarantine. Stop!
The coronavirus is sweeping over mankind.
Everybody must be alert. It's a global pandemic we can never take for granted.
Omulwadde wa corona temubuzanyisa bange.
Kila mtu must be alert. It's a matter of life we can never take for granted. Discipline and personal hygiene, and make sure you regularly wash your